Medical news of the week, we are joined by our resident medical expert, board-certified ER doctor, Michael Daignault. Doctor, thank you so much. So we heard that the mayor found out she was positive in routine testing, and that brings us to, we were testing all the time, no matter what, or even if we didn't have symptoms. How should we be conducting ourselves in terms of testing protocol?
So this is a really interesting development, right? As far as we know, the mayor is asymptomatic. As you mentioned, this is routine testing. So the question is, should we be doing routine testing again? I think the answers are found in the wastewater testing. And so as you mentioned, we're not doing as much testing, but you know, wastewater will show what it is no matter whether we test or not. And interestingly, in New York City and here in LA, the wastewater concentration of COVID peaked at the beginning of June. And we're starting to see a downward trajectory in LA, thankfully. But I suspect that if we did a lot more routine testing, we would pick up a lot of positive tests.
Sure.
But the important thing to remember is that the wastewater testing looks for viral shedding. That doesn't correlate to actual disease. And so, you know, we have to really make that determination. And the reason we know that is because the ERs and the hospitals are not being overwhelmed. And because there's so much immunity out there, people will test positive. They might not have symptoms. They're not going to spread it. So, you know, we're in the endemic stage of the pandemic this summer, and I think, you know, in a relatively good place.
You're in the ER all the time, so Are you seeing the positive tests?
No, and, you know, we only test if it's clinically relevant now, and somebody has symptoms of respiratory disease or pneumonia, we'll do the test only.
Okay, well, we continue to learn more about treating COVID. Actually, a trial is finding that early treatment, this is really significant, the treatment of COVID with the diabetes drug metformin reduces the risk of long COVID in outpatients. So what are we learning about this? So this drug for diabetes is helping COVID patients.
Right, so this metformin is a type 2 diabetes medication that has been around for a while. It's very common, it's inexpensive. 60 tablets for a month-long supply is only $10, very inexpensive. And there has been a sequence of really important research trials looking at the benefits of metformin, and we've talked about this before, that it's shown to reduce the incidence of long COVID, it's shown to reduce the risk of hospitalization, and we weren't sure exactly how it was working. And so the study this week, the important thing as shown up on the screen here, is that we found that there's a 3.6-fold reduction in viral load. So we know that that is the mechanism for how metformin is working. And this is potentially very important because we could give this to patients who test positive for COVID along with Paxlovid and reduce the viral load, keep them out of the hospital, and potentially reduce transmission. So this is huge because this is the drug that we already have.
And we could have already been using this.
Right, and so as you know, these things take a long time. This is a phase 3 trial, so hopefully with this study, now that we know that the mechanism of how metformin works, we can progress to human trials and hopefully get the FDA to approve this to be used for COVID-positive patients.
Okay, so we're done with the COVID talk, but then this is really alarming. This is shocking, in fact. So among 27 large cancer centers in the U.S., more than 90% of them report shortages of a life-saving chemotherapy drug. This is leading many oncologists and pharmacists to forced to find alternatives. So what do we do about this?
I know, this is really scary because a lot of these chemotherapy agents have been around for a while. They're inexpensive, but unfortunately that's the reason why pharmaceutical companies are not making them, because they're not profitable. And it's not just the chemotherapy drugs. Like the U.S. government identified 300 drugs that were in shortage over the course of the last couple of years, including antimicrobials, heart medications, anesthetics, stuff that I use on a daily basis in the ER as well, in addition to IV contrast for CAT scans. And so a lot of the reason for that is because it's not profitable, number one, and number two, because 80% of the raw materials are outsourced to China and India. So I think the government needs to make a decision here. Either we're going to subsidize pharmaceutical companies to keep a backlog of these drugs in case, or potentially make like a strategic reserve of these medications like we do for oil, for example.
They need to make this decision quickly. Right.
I mean, we need to, this is going to get out of hand very quickly because a lot of these cancers are very treatable even at the end stage with these chemotherapy drugs.
All right. Dr. Michael Daignault, thank you so much.
Thank you.
I almost called you by your first name. That would be so rude of me. Okay. Dr. D, thank you. Thank you.